Treatment of fractures. It can be considered in 3 phases. Phase 1, emergency care. Phase 2, definitive care. Phase 3, rehabilitation. Phase 1, emergency care. Mnemonic. R-I-C-E. Rest to the part, by splinting. Ice therapy, to reduce occurrence of swelling. Compression, to reduce swelling. Elevation, to reduce swelling. Some of the commonly available articles used for vintage of fractures are as follows. Folded newspaper, foot rule. Pillow, wooden plank. Bamboo, umbrella, chest arm bandage, triangular sling. Splints used in emergency department are as follows. Wooden plank. Kramer wire splint. Thomas splint. Inflatable splint. Head halter sling. Phase 2, definitive care. Mnemonic. R-I-P. Reduction. Immobilization.
Preservation of functions.
Reduction is the technique of setting a displaced fracture to proper alignment. Immobilization is necessary to maintain bones in reduced position. Preservation of functions. Physiotherapy is given all throughout the treatment. Immobilization of fractures. Non-operative methods. Operative methods. Strapping, sling, cast immobilization. Internal fixation, external fixation. Steel wire, Krichner wire. Intramedullary nail. Screws, plate and screws. Fracture-specific implants. Pin fixators. Ring fixators. Complications of plaster treatment. Impairment of circulation. Tight cast. Plaster sores. X-ray of a child with simple fracture. Ischemic and deformed foot due to tight plaster. Plastic brace used for a sticky fracture of the tibia. The patient can put on shoes and go to work. Pin fixator. Ring fixator. Pin and plaster method. Phase 3. Rehabilitation of a fractured limb. Joint mobilization. Muscle re-education exercises. Functional use of the limb. General plan for the treatment of fractures. This flow chart shows the general plan for treatment of fractures. If a fracture is undisplaced, go for immobilization followed by physiotherapy. In case if the fracture is displaced, go for closed or open reduction. In closed reduction, if the fracture is in an acceptable position, then go for immobilization and physiotherapy, or if the fracture is in an unacceptable position, go for open reduction with internal fixation followed by physiotherapy. Open reduction straightaway is required for some fractures.
Plan of wound closure in open fractures.
This shows the plan of wound closure in open fractures. If it is a small puncture wound, leave as it is. If it is clean lacerated, then primary closure is done. If it is a doubtful lacerated wound, then observe for 2 to 3 days. If there is no infection, delayed primary closure is done. If infection is present, secondary closure is done. In case of infected wound, healing by secondary intention should be done.